So let me just maybe introduce the second session for today. Distinguished participants of the second day of the Global Evidence and Policy Summit, would like to welcome you back from this short break. I would like now to introduce our moderators for the citizen-backed evidence plenary, which is engaging citizen and providing evidence synthesis support panel. Maureen Smith, the co-chair, Citizen Leadership Group, Evidence Commission Canada, and Richard Morley, Consumer Engagement Officer, Cochrane, United Kingdom. The panel, I wanted to mention that this panel is co-organized with the Cochrane and the Evidence Commission. Over to you, Maureen and Richard.
Well, hello. Thank you very much, Fadi, for your warm welcome. And hello, everyone. Welcome to today's next session, which is called Citizen-Backed Evidence, Engaging Citizens in Providing Evidence Synthesis and Support, including for Evidence-informed Policymaking. So I'm Richard Morley, as Fadi said, the Consumer Engagement Officer with Cochrane, and I'm based in the United Kingdom. And I'm pleased to be one of the moderators for today's session, along with Maureen Smith. Maureen, hi, would you like to introduce yourself?
Thanks, Richard. It's great to be with you today and to be with these wonderful panelists. So I'm here today as the co-chair of the Citizen Leadership Group for the Global Commission on Evidence to address societal challenges, and I'm calling from Ottawa, Canada. So in addition to being part of the E2P Summit, today's webinar is the second webinar in our series titled Putting Evidence at the Center of Everyday Life, a global webinar series for citizen leaders and citizen-serving non-governmental organizations. You may watch the recording from our first webinar in the series, and we've just opened registration for the third session in the series called Battling the Bunk, bringing evidence and citizen engagement to bear in addressing misinformation, taking place November 2nd, 2023. We encourage you to register and to bookmark the registration. We'll bookmark the registration link in the chat.
Thanks, Maureen. So this series is co-hosted by Cochrane, the Evidence Commission, and the World Health Organization's Evidence-informed Policy Network. And all the partners have seized the opportunity presented by the COVID-19 pandemic to recognize the need to involve citizens in the evidence cycle, from co-production to the use of evidence. So if you're on social media, we do encourage you to tag our organizations and use the hashtag #evidence4life. And please note as well that we're recording today's webinar, and we'll be sharing the recording and slides after the session. So as Maureen said, we have an outstanding range of speakers joining us today, and here they are listed in their in their order of appearance with their organizational affiliations. So thank you to Clara, Laura, Vichan, Mike, and Alessandro for being here today to share your insights, and we'll hear from you shortly. Brenda, unfortunately, isn't able to join us today. Maureen.
So we've asked each of our speakers to take 3 minutes to address one of the 3 questions you see here on the slide. Following the panel, we have time to take your questions. Please use the chat box to pose your questions at any time throughout today's webinar. Our colleagues are on hand to answer your questions and share resources in the chat. And we're also asking our speakers to try to take questions in the chat.
Thanks, Maureen. So following the panel, we'll move on to a different section, a participant engagement session, and we'll give you more instructions at that time. So for now, let's welcome our first speaker, who is Clara. Clara is with the Knowledge to Policy Center in Lebanon, and she'll be addressing the question, how can citizen engagement contribute to evidence-informed policies? So over to you, Clara.
Thank you, Richard. Thanks, Maureen. So initially, coming from a clinical background, back then we have constantly advocated for patient involvement in decision-making as an initial step to ensure holistic, inclusive patient care. Now, this being said, it becomes paradoxical when decisions or policies could affect more than one life. At some instances, countries have failed to engage with utmost important users, which are citizens. Meaning where policies affect youth, who will know better about what affects them and their challenges more than the youth themselves? So the same applies when it comes to systems response to challenges and emergencies. And there have been evidence and documented evidence that clearly recognizes the importance of citizen engagement during epidemics and pandemics, and where health system response was most efficient and effective was where the engagement happened. Now, let me take you back a few years backwards, where the Knowledge to Policy Center, we were working on a policy related to early identification and intervention of children with disabilities and developmental delays. And we have noticed that there are several health system challenges that prevent identification of children with disabilities at an early stage. You might say, well, solutions are very clear. The evidence says develop tools, roll those tools on hospitals, primary healthcare centers, schools, say what, train the staff, and then we have a system that is up and running. Now, it might sound easy, yet there was insufficient local evidence on this issue, and the topic was not of priority to the stakeholders. For this particular knowledge translation process, we have engaged citizens not only in understanding the current governance, finance, and delivery systems, but also to take part in the national policy dialogue that engaged several policymakers around one table. And what we have noticed is that where evidence was clear-cut on the solutions, contextually, a father whom we have engaged with in one of our citizen consultations, whose son just turned 6 years old, not knowing that his son's speech delay was due to hearing difficulties and had no idea where or how to get his son assessed or even access services. So this clear-cuts the importance of contextualizing the evidence-informed policies to make it relevant to the context that we have through citizen engagement. Now, not only that, but because this topic amidst several crises that we have was not of priority for decision makers or policymakers, and policymakers had to hear the reality from those that are living through it to elevate it to the political and policy agenda. Now, citizen consultation in the overall framework of evidence-informed decision-making process, it's dynamic, meaning it's constantly molded more into the actual output that we are aiming to establish. And therefore, it can be implemented from priority setting to the design, to the contextualization, or even evaluation and implementation of evidence-informed policymaking. The key in this process is to ensure that we engage the citizens and well inform them prior to the citizen engagement and during the citizen engagement, and to implement systematic approaches when the citizen engagement is happening. Now, this does not come without a cost. There are several challenges typically in citizen engagement, from the selection of participants and so on, but sometimes we don't have the luxury of time to go with an extensive process of consultation. But when there isn't a luxury of time to do so, at least a small scale level of engagement is very important to contextualize and ensure ownership of evidence-informed policies. Now, finally and ultimately, to achieve policies that are adaptable, relevant, and implementable, it becomes imperative to start transitioning towards multifaceted systematic approaches of engagement that encompass the participation of citizens themselves. Thank you, everyone.
Thank you so much, Clara. It's a really powerful call, I think, to us all to engage people, and a revolutionary possibility, I think. So thank you. And we're going to move on now to Laura. Laura is with the Instituto Veritas in Brazil. She'll be addressing the question, how do different organizations manage trust or distrust in science? So over to you, Laura.
Hi, everyone. Hi, Maureen, Richard. Thank you so much for inviting me to join. I'm a very fast-speaking Brazilian, but I am mindful of our interpreters and I'll try my best to speak as slowly as possible. I also don't have slides, so this slide is just for all of you to know where I come from. But I was put into this task of speaking about distrust, which is a very important topic in my country, in Brazil. Gaining as much support from citizens and diverse citizens is quite essential to implement any policy or even any knowledge finding in Brazil. So my main points here today is that it seems quite obvious, right? But to battle distrust, of course, we need to build trust. But this is often something that we say out loud, but we are very hard doing. In my experience, building trust means not overselling science for citizens. Often we try to sell our findings or our work as something very important, but for most citizens, what is quite important is their demands, is their day-to-day lives, is their context. And often our science doesn't get to these topics so easily. So we need them. And we can't build an hierarchy and expect trust to be given to us. So we, both in Instituto Veredas and in the already mentioned today Brazilian Coalition for Evidence, and in our other regional collaboration, the Latin America and the Caribbean Evidence Hub, we work so hard. We really deposit as much time as we can, building trust, building meaningful relationships, being as transparent as possible, as responsive as possible to any citizen that we are engaging from the get-go. This means really engaging citizens in the early stages of any evidence-informed policymaking process, being completely upfront about what methods we will apply. Often we don't speak about methods with citizens because we imagine people won't understand what we are talking about. But if we can't explain what we are doing in a very, very simple language, probably we are not doing science well enough. So it's quite important to be able to speak about methodology, to engage citizens when we are first drafting what our research and policy questions are. And something that Professor Sandy Oliver in the UK talks a lot about, and I'm very inspired by it, is being completely upfront about our uncertainties. Because if we try to oversell science, as I mentioned, probably we'll have many distrustful partners jumping in. My other topic for today is just helping to create an environment where people feel comfortable and they feel they can indeed contribute to science by sharing something they know, they feel, they think. So giving proper space for citizens to reflect on their context, to understand the gaps from whatever findings we have, and invite them to contribute is something quite important. In our work here in Brazil, equity is a main word for any kind of evidence to policy interaction. And we found that inviting citizens to help us understand inequities, help us understand topics such as gender inequity, racial inequity, how the different experiences depending on where you live affect our knowledge and affect our policies, is a great way for people to feel they can contribute to science, feel they can contribute to the implementation of any policy strategy, and really brings people closer to trying to find solution to these barriers. That is something that we really need support. So these are my main topics. I know it's quite obvious that to manage this trust, we need to build trust, but I would say that it takes loads of time, loads of mindful effort, and really considering how can we build a equal environment that everyone feels comfortable sharing what they feel, and being very responsible that when I ask someone to share what they experience, I need to really take this into account, and they need to see this reflected in the knowledge and in the policy that I'm building afterwards. So this is my comment for today.
Thank you so much, Laura. Some really important issues there. The infodemic, which the WHO has identified as such an issue, a problem for people involved in evidence. Thank you, Laura. So Maureen, over to you.
Thanks, Richard. So I will be introducing the next three speakers. We'll start with Vicharn. He's with the Prince Mahidol Award Foundation in Thailand, and he will be addressing the question, what strategies have organizations applied to engage initiatives that promote citizen-backed science? Over to you, Vicharn.
Thank you. Hello, everyone. Can I have the slide, please? I will share with all of you our experience on Thai system approach of citizen-backed evidence. 31 years ago, Health System Research Institute, or HSRI, was established. It is a governmental autonomous body attached to the Ministry of Health. As shown in the diagram, evidence generated by HSRI gave birth to the other 5 organizations in Thai health systems. This diagram is a very oversimplified version of our health systems to illustrate evidence-informed organization structure and behavior in our health systems. Thai Health Promotion Foundation was born 9 years later. It is a mechanism to use 2% of tobacco and alcohol tax to promote health of Thai people. Each year, Thai Health uses about $120 million tax money to support lay people around the country to take part in the health promotion and disease prevention activities in their communities, giving rise to collaborative development of healthy lifestyles in the communities, and communicate to the general public for national policy development. 1 year later, National Health Services Organization was established to manage Thailand's UHC, or Universal Health Coverage, enabling the country to spend less than 5% GDP to cover high-quality healthcare to all people, with evidences generated by the 2 organizations in green on the right. It took more than 10 years through action research to establish an NHCO, or National Health Commission Organization, a citizen-engaged evidence-informed policy body. NHCO uses many tools to get citizen engagement for health policy development at various levels. One powerful tool is Health Assembly, participated by the people. These health assemblies must be chaired by a respected person who is non-health professional. One major common mechanism for all 3 organizations in deep blue is the governing board of each organization must consist of members from various sectors, including citizen groups representatives. The 2 organizations in green on the right, namely IHPP, or International Health Policy Program, and HITAC, Health Intervention and Technology Assessment Program, are evidence-generating organizations which work in both citizen engagement and policy engagement manner. They produce evidences to make Thai health systems a learning and wise system in the way that it both directly and indirectly backed by the citizen in evidence generation. let me emphasize that the three organizations in deep blue are citizen-backed user of evidence. Thank you very much.
Thank you. Thank you so much, Facharn. It's wonderful to see the infrastructure that you've built to ensure that citizen engagement is part of your evidence system. I'm going to our next speaker is Mike. He's with the McMaster Health Forum in Canada, and he's addressing two questions. What strategies have organizations applied to engage initiatives that promote citizen-backed evidence? And how can this citizen engagement contribute to evidence-informed policies?
Thank you, Maureen, and thank you for having me here today on the panel. So I'm going to address these two questions in an integrated way and with examples, because I think these two questions are, in a way, best addressed together because the best strategies are designed to support evidence-informed decision-making. So I'd like to just share a few examples with you with the time that I have. So the first example I would like to share is a new citizen engagement and evidence-informed policymaking guide that's going to be coming out. So in the fall, the WHO will be launching a new guide to many publics that focuses on citizen engagement and evidence-informed policymaking. You're authored by Oliver Escobar and James Henderson, and I acted as the chair of the editorial team. The guide to many publics, it focuses on many publics as a specific form as citizen engagement, with an eye to being able to adapt them to many different contexts. Many publics are forums that can include a cross-section of the population that are selected through a civic lottery to ensure that you're engaging citizens from all walks of life, and with an aim to inform policy and action. The guide provides a really helpful overview of how to organize many publics in the health sector, and is organized into 5 chapters, and those chapters collectively give a learning process for those who might organize, commission, or facilitate a citizen engagement project. The first chapter focuses on many publics as a form of citizen engagement and evidence-informed policy, and then the other 4 chapters then focus on very practical steps that are needed to organize a citizen engagement project that focus on the inception, the preparation, deliberation, and influence. Once launched, Tanya and her team are planning for some capacity building workshops, and to find more details and receive updates about those, please do sign up for the EVIPNet LinkedIn group that will provide those announcements when they're available. The other examples I would like to share, I want to highlight 3 examples of how myself and others at the McMaster Health Forum are engaged in citizen engagement initiatives to contribute to evidence-informed policies. The first are citizen panels, and this is one form of many publics. So our citizen panels, there are 14 citizens are engaged with diverse backgrounds and lived experiences to deliberate about pressing health and social system issues. We pre-circulate a plain language citizen brief that describes what's known from data and research evidence about a problem and its causes, potential solutions to address it, and key implementation considerations. And participants are then convened to a virtual or face-to-face deliberation where they can share their ideas and experiences on the issue and learn from research evidence and views from others. We typically aim to convene these panels prior to a stakeholder dialogue that convene about 20 to 22 system leaders, so that those actions are prioritized to address an issue by decision makers, including citizen leaders, and that those deliberations with system leaders are informed by the ideas, the experiences, the values, and preferences identified from the panels. We've found that convening the panels in this way can have profound impacts on deliberations among system leaders, including identifying policy options that are acceptable to citizens. We've also convened an integrated set of what we call living citizen panels and dialogues, that focused on the politics of a health human resources crisis in Canada, where the citizen panel was reconvened with the same people with an updated set of issues to deliberate based on what was found in the first panel, in the next dialogue, and then helping to inform the subsequent dialogues that came after it. So the second example of citizen engagement I have is for conducting contextualized evidence syntheses that are produced in a timely and demand-driven way that engage citizen partners in key stages of that synthesis. So this can include framing questions in scope, reviewing and interpreting results, and co-designing dissemination materials and plain language summaries and infographics. And a recent example that we're working on is a living evidence synthesis of approaches to address misinformation that has engaged 4 citizen partners in the grant application. That includes Maureen, who's chairing the call today, and who collaborate as part of the research team. So the first version of that will hopefully come out in September. And then the last example, which you might have heard in the last session, is acting as the co-lead and secretary for the Evidence Commission, which has prioritized putting evidence at the center of everyday life as one of its 3 implementation priorities. A key part of that is focusing on ensuring that citizens have access to best evidence check claims, and simple to use evidence-backed resources and websites to make choices at all times and not just during global crises. So I'll end it there. So thank you, everyone.
Thanks so much, Mike. And I'll take my moderator's privilege. And I've had the pleasure and the privilege of attending some of the citizen panels that McMaster holds as an observer or as a note taker. And I think the one that you talked about, the living evidence panel, I had never attended something like that where you brought the people back together again. And there was a lot of, it was very powerful. And I still have really, I was marked by the reflection that people had done from the first panel to the second panel. So thanks for presenting that, Mike. So our last panelist is Alessandro. He's with the Organization for Economic Cooperation and Development in France, and he'll be addressing the question, how can citizen engagement contribute to evidence-informed policies? Over to you, Alessandro.
Thank you. Thank you very much, Maureen and colleagues, and also thank you very much to participants for the very rich conversation in the chat and in the questions. What I wanted to do in my 3 minutes was to address the issue of citizen participation in evidence-informed policymaking, especially focusing on the role that deliberative practices are now taking in most, I would say most countries around the world. Now, the first, I would say, good news is that deliberative practices are on the rise. In our latest survey, we have identified more than 600 practices around the world that meet our criteria. I will put the air table here in the chat if you want to have a look at it. Obviously, this is not comprehensive. It's based on desktop research, so there are limitations of language, etc. But it gives a sense of the diversity and the importance that this practice is taking. However, involving citizens in evidence-informed policymaking through deliberation has both advantages and disadvantages. And I wanted to briefly mention those because I think it's important for the future of our democracy that we address those to make sure that deliberative initiatives are actually successful and don't leave citizens disaffected or unhappy about the experience. Because in fact, the first, I would say, most important issue to be addressed is how we can move from deliberation to implementation. Deliberation refers to the act of citizens during the initiative, that the fact that they deliberate on a specific topic. And one of relevance for today's discussion is, for example, the very recent Citizens' Assembly on the End of Life law in France, which happened before the summer, was closed before the summer. So citizens did deliberate, and a report was sent to the Prime Minister, to the President. However, we will have to see now how that is transformed into a new law. Obviously, this is key to give value and respect to the time and effort of citizens. And obviously, this changes a lot according to when the deliberative exercise is taking place, meaning at what point of the policy cycle, if it is done in a moment where it is still possible to influence the policymakers or parliament or not. And this brings me to the second issue that is becoming more and more important, which is some frictions that are happening between deliberation and representation, meaning what is the role, the respective role of citizen assemblies vis-a-vis, for example, the role of parliament when coming to a decision on a law or on a policy. Now, this is obviously very important to address for the success of the event, because otherwise citizens would feel completely betrayed by the exercise. We have developed at the OCT a series of guides to help policymakers and citizens to organize. You can find them in the link that I've just put in the chat. But obviously, many more are in the making, including the one that Mike just mentioned. It's not the knowledge that is missing; it's the capacity to transform this knowledge into good and successful practices. And just to conclude my intervention, I focus on deliberation because I think it's the most interesting and vital initiative that is taking place in this field of citizen participation at the moment. But obviously, there are very many others, consultations, etc. And this can become complex for policymakers, for civil society activists to understand what is the best way to be engaged in a policy cycle. And therefore, we have decided. I'm very sorry. I have a colleague speaking, but I will surely ask her to lower her voice, please. I will surely conclude my intervention in a second by linking my last publication that I mentioned, which is this guide on citizen participation processes that I put in the chat. And I apologize for the eagerness of my colleague to speak.
Thank you, Alessandro. Really comforting to know that deliberative practices are on the rise. And thank you for putting those resources so that we can share best practices and guidelines and work together on this. Okay, over to you, Richard, for the Q&A.
Thanks, Maureen. Right, so we've just got a few minutes, just 5, because we're running slightly late, just to try and answer a couple of your questions live before we move on to the next session. So I'm going to start by picking out one interesting question that was asked by Denise Razuk, which went, please, Laura, can you comment on how the political context affects trustful relationships? And she referred to the kind of populist government that was recently in power in Brazil, and what clues you might suggest, to respond to that element, which is to a degree undermining confidence in science. Laura, how might you respond to that?
So I type an answer for Denise, but just would like to highlight that the political context is always affecting trust in science for the better or worse. And usually what we try to do if we have a very negative context around science is focus on the micro politics and the community level engagement to help and develop multiplicators that are community members that can develop skills of critically appraising the process of producing evidence or the types of information that are being presented, and really engage from the get-go in the co-creation and co-production, so they feel an ownership, and then usually are way better than us in multiplying this kind of knowledge in the local context. So I think usually when the macro is very bad, turn to the micro, and maybe you get some luck there.
Thanks, Laura. Really good answer. Maureen, do you want to ask or point out another question?
Yes, I do, and we'll have 2 minutes to answer that one because we want to get to our participant engagement phase of this webinar. So it's a question from Kate, and it really is about citizen engagement and how do you engage patients from citizens from the very beginning. And I would welcome any of our panelists who would like to tackle that one. Laura just kind of basically touched on it at the end of her presentation. to give us at this point a 1-minute answer to that question. And please note that in the chat, we're trying to answer, there's a team trying to answer as many questions as possible also. So who would like to tackle the challenge of getting citizens involved from the very beginning?
Maybe I can say something very briefly, Maureen.
Thanks, Mike.
From my perspective, what's worked really well is building partnerships with different groups that have networks of citizens or people with lived experience. And I mean, you've been such a resource in bringing some of those networks to our team at the McMaster Health Forum and the Evidence Commission and so on. But also in convening citizen panels, we've worked with many different groups who help with recruiting to different people who have lived experience, if that's the focus of the panel, or working with other groups who can recruit much more broadly across an entire population. So I think building those partnerships and sustaining them over time and working with them in a meaningful way is critical in doing that from the beginning and throughout a process.
Thanks so much, Mike. Okay, into the participant engagement phase of the webinar, and over to you, Richard.
Thanks so much, Maureen. Right, okay. Now we're going to move into the second half of our webinar. So this is all about citizen engagement tools and methods, some of which we've talked about in the first half of our webinar. And to kick us off, we're going to launch a poll, and that's going to ask you to rate your level of familiarity with citizen engagement tools and methods. So our IT team, our wizards behind the scenes, if you could launch that poll for us, and then we'd ask you to take part and identify whether what your experience is with tools and methods. So can we launch the poll? Yeah, here we go. You should have a pop-up in your screen now. It says, how would you rate your familiarity with tools and methods for citizen engagement in deliberative processes? We've been hearing a little bit about deliberative processes. So your choices are not at all familiar, barely familiar, somewhat familiar, fairly familiar, and very familiar. So if you could choose and submit your response, and we'll share the results in just a moment. If our tech gurus could close the poll and share the results, that would be great. Thank you. Oh, it popped up for a second. There we go. So quite a range of responses from right across. I guess the smallest group is those who are very familiar with tools and methods, but quite a lot of us have some familiarity. Right, okay, thanks very much for that. Now, having thought about that, we'll move on to the next element of our interactivity. So Maureen, this is over to you to talk about the Padlets.
Okay, so we're now going to invite you to interact with everyone on the call on Padlet. Just a reminder that the instructions are available in 6 languages, and that's in the chat. So if you're not familiar with citizen engagement methods and tools, then please join Padlet number 1 using the link shared in the chat box. Then Padlet 1 people will discuss 2 questions. What are you interested in learning about citizen engagement in deliberative processes? And which health topics do you believe should be prioritized for citizen deliberation in your country? So remember to stay logged into the Zoom webinar while you access Padlet. If you are familiar with citizen engagement methods and tools, then join Padlet number 2, where you will address 2 questions. What are the benefits of tools and methods you've used for citizen engagement for deliberative purposes and its benefits? And what are the challenges of these tools that you've used? What strategies did you employ to overcome them? So we'll let everyone get set up with Padlet, and then we'll come back. Richard and I will come back to check in on you, and just keep putting in all of your ideas and all of your insights into the Padlet. So if our IT people could launch that, that would be great. Thank you.
Okay, Maureen, I can start to see some of the comments coming in on the Padlet. So there's a reference here to work that's being done by the National Institute of Health Research in the UK, and tools that they've been developing, and frameworks as well. So, for example, the United Kingdom, the UK National Institute of Health Research has been developing some standards for involvement, with which I'm familiar. And there's a reference to Cochrane as well, of course, which attracts my interest, working for Cochrane, about the work that's been done there relating to plain language summaries, and something called Evidence Essentials, which is a tool for engaging, it's an online learning to support involvement and engagement in evidence synthesis.
Padlet 1 is very busy, Richard. People have a lot of different interests in learning about the process. There's a common theme about priority setting, like who should be setting those priorities, and should it be about what the policymakers see as the most pressing issues, or should it be about what the citizens think? So that's quite interesting too, and things are just keeping on coming in. So keep populating those Padlets.
Yeah, I wonder if any of the panelists who spoke earlier are on the call, and if you see anything that's in the Padlets, if there's anything that stands out for you, please do feel free to comment. You know, particularly thinking about the topic that you addressed in your presentation.
So Richard, I'll just jump in very quickly and comment.
Good.
I think this comment here on how do we decide who will participate and who they represent is something quite important, because of course, when we are talking about citizen engagement, we're not talking about every citizen, any citizen. Some resources, some very interesting resources have been shared in the Q&A. Sharmila shared one typology they developed in Brazil. I think it's worth mentioning. Maybe it will be posted on the Padlet also. But usually from our experience, we try our best to identify voices we want to be heard and ask these groups to identify a representative and the way they would most like the engagement to be conducted. I also answered a question regarding this, but I think this topic on how we decide and how do we enable participation, not only logistically, but in a meaningful, equitable way, is something that has been coming up a lot.
Thanks so much, Laura. That's really helpful. Certainly amongst the people who've identified themselves as more familiar, people are talking quite a lot about the difficulties of the challenges of ensuring proper involvement, engagement with, you know, right across groups that are traditionally, you know, have historically been excluded from research and involvement. That's a challenge that people have identified.
That's good to hear, Richard, because a common theme in the Padlet number 1, for the people who are not as familiar, is exactly about that, about engaging with equity deserving groups, or in, you know, and how to get those people to the table, and all of those challenges. So happy to hear that there are, you know, there's some discussion about that in Padlet too, and hopefully some of the people on the call will put in their resources in the chat if they do have resources, because that's certainly coming up as a common question from the people who are interested in learning more about those deliberative processes. So
that's really interesting. The other thing that's I find really encouraging, actually, from the things that are being published, is the kind of global spread of resources. You know, there's countries here mentioned: Serbia, Myanmar, Canada. You know, right across the globe. When I think kind of historically, typically, resources and activity have been found mostly in the Anglosphere, the English-speaking world, the developed world, and not so much in the global South and the non-English-speaking world. So it's, to me, it's really encouraging to see the global diversity that's represented in the comments.
And I'm also seeing in our first Padlet quite a bit of interest in behavioral science. And I think behavioral science has kind of risen to some more importance than we afforded it before because of the pandemic. And there's quite a few people who are interested in learning about the role of that and how citizen engagement can the intersection of citizen engagement and behavioral science and all of those methods. So that's I found that quite interesting to see also. And as far as the health topics that people are prioritizing, I think every health topic in the book is there. I think the lesson from here is that health topics are really according to your context. So, you know, we see topics that are based on what people are experiencing in those countries, basically. So it's like a medical book here. There's every condition is here, and that's quite interesting.
So Maureen, just to jump in for a few, I've noticed a lot of comments on the best way to engage citizens. So the evidence-informed policy processes of how do you develop the policies themselves is so multifaceted. So there isn't a straight answer to that. There are different ways of engaging citizens, from priority setting to the conceptualization of the topics themselves. So that's totally dependent of what we're trying to get out there. If we want to engage them because we want to contextualize the policies that we have, so that would be at the stage of the development process. If you want to identify what are the key priorities when it comes to a policy itself, so that would be kickstart from the beginning. So that is highly dependent on what we're trying to get out. Ideally, it will be through all stages. So that would be a continuous engagement from the conceptualization, priority setting, and up to the evaluation of policies. And ideally, that would be the best format. And that reflects back to some of the challenges that have been also reflected on the Padlets, where they're discussing time and biases and how limited it is when it comes to citizens that are not interested in being engaged. And to be very honest, yes, that's tough. The science of it is very tough, but keeping through the direct contact we usually have, and in our engagements, we have a person who's the outsource of the engagement that constantly has that brought together and keeps the communication going with the different citizens. And so far, we had an excellent experience in that.
Thank you so much. Okay, it's up to me to give the 2-minute warning. So if our IT experts could share Padlet number 1 on the screen, well, I think it's still open. You could still be populating it, but we're going to get some brief insights from our experts who presented on the panel today. So looking at Padlet number 1, if there's anything that resonates with you, or you would like an aha moment, or you'd like to comment, we would like you to unmute and share that with all of our participants. And just a big thank you to all the participants who've been part of Padlet number 1 and putting in all of your what your interests are and the topics that you'd like to prioritize. So briefly, if there's someone from the experts who'd like to comment, we would love to hear from you.
So Maureen, I'll jump very quickly just to comment that I see a great opportunity here because there is synergy among health topics that people would like to address. And if anyone hasn't put down their name or country, I would advise to do that, because we can have here a very simple, beautiful tool to connect different countries that might have the same priorities and want to work together. And this, of course, can make the work very easy and colorful.
Oh, that's lovely. Okay, over to you, Richard, for your Padlet 2 insights.
Okay. Yes, so that you can see on screen now the Padlet from those people who identified themselves as being more familiar with this area. Again, if there's anyone amongst our speakers who's got anything that they see, anything that speaks to them, yeah.
Can I? Yes.
Please. Yes.
So two things quickly. One on the Padlet 2, and another one as a question in the Q&A. In the Padlet, there was somebody, I think anonymous, stressing the importance of communication for successful participation. This is an immense area of work, I would say, and I just wanted to touch upon it to say that at least from the way we look at things from the OECD, so from sort of the government perspective, the way government communicates about emergencies and in general about engagement opportunities is absolutely fundamental to ensure that citizens are willing to engage, are aware of the issue, and also represent a broader I would say, perception of society than their own, that they're part of a broader conversation before they start engaging. Now, very few countries if you look at our global report on public comm, which we published a couple of years ago, very few countries' communications offices are aware of the link between public communication and engagement. They still see public communication mostly as an exercise of politics or information, whereas in fact it should be much more. I'll stop it here because we don't have time, but it's a very good question. And the second thing is, well, how governments have reduced the space for engagement during COVID pandemic and how to avoid that in the future. I don't have a clear, easy solution. What I can say is that as the OECD, we have strongly stressed how the opposite was to be done, that in a moment of national emergency, opportunities for consultation should be increased, obviously making sure that they are done in a safe environment, which is absolutely possible. Unfortunately, it's a matter of political debate. At the national level, there's no global solutions. What I can say is that international organizations like ours, like WHO, should be very alert and stigmatize every time governments use emergencies to reduce instead of increase engagement opportunities.
Thanks so much. Two very, very powerful points there. Mike, I know you had your hand up, but I'm afraid we've run out of time.
No problem.
So, Maureen, over to you to wind things up for us.
So on behalf of Richard, our partners, and myself, very heartfelt thank you to our expert speakers and all of you, all of the participants, for joining us today. We ask that you please register for the next session of the series titled Battling the Bunk, Bringing Evidence and Citizen Engagement to Bear in Addressing Misinformation, taking place on November 2nd, 2023. And that adjourns today's webinar. Have a good day, everyone, wherever you are in the world. And I will pass things back to Fadi.
Thank you, Maureen. Thank you, Richard. This is really quite, and thanks for all the panels. This was really quite a rich discussion about citizen engagement and citizen-backed evidence. Thank you so much for all the insight, and thanks also for all the participants for the great contribution and also insight that they provided over the Padlet. I would like to certainly, engage everyone, engage all the panelists, all the moderators today for a very engaging and I think important discussion that we already covered today on collaboration, partnership within the evidence ecosystem, but also on citizen engagement and evidence-informed decision-making and deliberative processes. I believe it has been really a great day for all of us in this summit. I personally learned a lot from today's discussion. I hope you all have enjoyed the panels and the interactive sessions. I would like to remind you, please, for everyone, just remember that we'll start our third day tomorrow at the same time as today. We are certainly excited to see you again tomorrow. And please do not forget to visit and join the EVIPNet LinkedIn group to connect with each other and also to engage with your peers. And for the Padlet discussion, will continue today as well over the EVIPNet LinkedIn. So before you leave the virtual venue, please, share, emojis are great. So please feel free to share your feedback with us about today using the emojis in the chat or the reaction button. I would like to also thank Alex for the great, insightful, fascinating drawings that you already put, summarizing all the discussions coming out from the panel, and they will be available as well later on. So have a wonderful day, afternoon, evening, and see you all tomorrow. Thank you.